relaxed. But I just wanted to see what that felt like. Now, some people doing it for a 4 count is too difficult. If it is for you, if that seems like too long to take in a breath or too long to hold your breath, then just do it for a count of 3. It doesn't really matter, but the idea is to get in that sequence. Now, just doing that deep breathing is relaxing. We're designed to really do that abdominal breathing. That's really the way we should breathe all the time. If you watch babies, like Laura, you have a new baby, if you watch babies, they abdominal breathe naturally. But as we become adults, sometimes we forget that, and we just breathe up through our shoulders. Okay? But what we're going to add to that is something that's even more effective, which I'm going to have you demonstrate, or I'm going to have you practice in just a second. We're going to add what's called progressive relaxation to that. So once you get in that rhythm, and I would have you kind of lay or be in a comfortable position and do that maybe 4 or 5 times to get in that rhythm of breathing, then what we're going to do is when you take in that deep breath and you hold it, you're going to take your fist and make a really tight fist, like contract the muscles as tight as you can. And then when you blow the breath out, you're going to use your mind to actually relax those muscles as much as you can as you blow that breath out. And then it's called progressive because you work through your body. The next time you take in that deep breath, you tighten up your forearm. And then as you blow it out, you let that relax as much as you can. And then you tighten your shoulder. And I have people work through their body. And I usually have people start in their hands and work toward their feet. And you can be creative. You can tighten up your face. You can, scrunch up your shoulders. And actually, a good thing to do is if you have an area where you feel tightness or you feel stress is affecting you, you especially want to make sure that area is an area that you contract and then, as you're breathing, relax. The beautiful thing about this is that you can train yourself to actually get better at relaxing. Just like you can train yourself to, you can build a muscle up by exercising, or you can train yourself to, shoot a layup better or play a piano. You can literally, your nervous system can become better at relieving stress. The great thing is that if you do this regularly, now the first couple times you do it, it may not necessarily be relaxing, but if you do it regularly, you can actually train your nervous system to the point where if you encounter stress, like let's say you get an argument with somebody, or somebody is you have a deadline you have to meet. Literally taking in a couple deep breaths can automatically, once you're conditioned to it, cause your body to start to relax. There was some of you might have heard of Pavlov's dogs. Pavlov is a renowned psychologist who found that when he would ring a bell and then feed dogs, if he did that long enough, eventually he could just ring the bell and not feed them, and they would start to salivate because they were anticipating that. Their body started to react to as if they were going to be fed, even though there wasn't any food present. Same kind of thing with our nervous system. If we get in the rhythm, or we get in the habit of associating that deep breathing with relaxation, you can entrain that into your body. Okay? And so we're not going to go all the way through our body, but let's just practice this just with a couple muscles so you can kind of see what we're talking about. Okay, so go ahead and we'll just do one round of the deep breathing by itself. So go ahead and take in a really deep breath all the way down to your belly. Try to fill it all the way up. And let's hold that for a count of 4. Blow it all the way out. Hold that for a count of 4. And now we're taking another really deep breath. This time when we hold it, we're going to take our hands and just make a really tight fist. And as we blow the breath out, try to just consciously let your muscles go relaxed. Hold that empty. This time we're going to tighten up our biceps. We're going to take in the deep breath. And as we hold it, we're going to tighten up our biceps as tight as you can. And as you blow the breath out, consciously just let those muscles relax. And we'll stop there, but I just wanted to give an idea of that. And a very good way to use that technique is that for people that have trouble sleeping at night, stress a lot of times can keep us awake at night. Or a common thing that happens with people is they'll fall asleep, but then a few hours later they wake up and they can't go back to sleep. And so a great way to utilize that technique is to go through your body. Like I said, how people start in the hands and work toward their feet, or vice versa. I always tell people that if you can get all the way through your body and you haven't fallen asleep, then get up and do something else. Get up and do some reading. Get a little something to drink. Do something. Because the longer you lay in bed, sometimes the more anxious you get about the fact that you have to get up. And it's getting closer and closer to when the alarm clock is going to go off. But that technique can be really valuable for somebody that has trouble sleeping. All right, some other things are visualization. I mentioned before that when we're in that fight or flight mode, let's say it's a real emergency, we get attacked by that bear or that lion. I mentioned that our nervous system and the way we react to that fight or flight response doesn't know the difference between a real emergency and a perceived emergency because you have a deadline or you're having an argument or whatever else is causing stress in your life. The good thing is that it also doesn't know the difference between actually being in a relaxing environment and just imagining you are. So visualization can be really powerful. And so this, though, is very unique to the person depending upon what makes you feel relaxed. So one person might just literally, if especially somebody that's under chronic stress, they might take a few minutes, and you could combine this with that breathing technique we just covered. They might visualize that they're on a tropical beach someplace. They might think about being, in a place that was very safe and secure and where they felt loved. So maybe they imagine that they were, at the family dinner table, at Thanksgiving with all of their relatives. Okay. For some of them, maybe the relatives are causing the stress. Maybe they want to imagine that they're someplace all by themselves away from that. Okay. But the thing is that you can anytime, pretty much anywhere where you have a couple seconds, go someplace that's safe and relaxing and secure in your mind. And there's a number of audio techniques for stepping you down into this visualization and stepping you back up. In other words, like a lot of them will have you imagine that you take a step down a staircase and you feel just safe and you feel relaxed, and you take another step down the staircase, and in your mind, now maybe you start to hear the waves on the beach. Okay, and the next step you take down the staircase, now you can start to feel the breeze of the ocean on your face, and then the next step down, your foot is in the sand, and you can imagine what that sand feels like. And so the more real you can make it, the more details you can add, the more effective it is at tricking really kind of your nervous system into relaxation. Another nuance that you can add to this, and again, this can be combined with that breathing technique, is smells. Smells, and it doesn't strictly mean necessarily aromatherapy, but that's one of the reasons that aromatherapy works, is that smells cause a very strong reaction into our nervous system, into what's called the limbic system, which is below our level of perception. In other words, it's like you've probably heard of pheromones. It's what might attract a female to a male or vice versa, just by the pheromones that the body produces. Well, many scents affect us in that same way, below our level of even conscious perception. What's cool is that women might go out, or men even, and buy expensive perfumes, but a lot of the research shows that scents like vanilla and cinnamon and spearmint and peppermint have some of the strongest reactions on us. Okay, so again, that might be what's relaxing for you. They've shown specifically for men that like apple pie spices seems to be very relaxing and actually sometimes arousing as an attractive force to a man. For a woman, like lavender can be very relaxing. It's kind of people usually think of like the 60s or 70s when they hear this, but like patchouli, which is essential oil, can be very relaxing. Other essential oils can be very relaxing. And an essential oil is something that you might use for aromatherapy, like to put on like a light bulb or put on something that heats up so that the scent gets in the air. There's also something you could literally like rub under your nose if you're under stress, or you could put someplace on your body where it would, almost like perfume, where it would emit the smell. Mint has been shown to actually allow athletes, when they test them on like a treadmill, to actually be able to have increased endurance just because of the smell of mint somehow affects them physiologically, and they have better endurance when they smell that. So again, kind of, you want to set the stage as much as you can, and these are tools that you can use all of or some of, or whatever you decide, as a way to kind of help you to have a bigger toolkit for combating stress. And most of you know this already if you're watching this presentation, or if you're here, that the chiropractic adjustment is a very powerful thing that helps to prevent stress from negatively affecting your body. And the reason is, again, because stress is regulated through our nervous system, through those neurotransmitters when you're in that fight or flight mode, your physiology changes, like I said. When we adjust the spine and we remove nerve interference, it resets your body from that fight or flight mode to that normal physiology. It's literally like kind of like flipping the circuit breaker when you overuse a circuit in your house. That a lot of times when we're under too much stress, it literally causes subluxation because the nervous system literally can't cope with that emotional stress. When we correct that subluxation, it helps to allow the nervous system to function well and those neurotransmitters to be produced. Okay? So this isn't just, any chiropractor would tell you that's our clinical experience, but there's also studies that have shown this. Even patients that have, again, clinical depression, especially neck adjustments, but really the whole spine, but the neck has the biggest effect on your communication back and forth to the brain, have been clinically shown to dramatically reduce stress. One of the common things that I find with newer patients is that they might come in with some kind of a complaint, whether it's digestive complaints or if it's a baby for ear infections or somebody that has back pain or neck pain. And one of the common things that they'll notice first is that they sleep better or they feel more relaxed after being adjusted, maybe before even their complaint that brought them into the office improves. Okay? I have to actually remember to warn parents of young children that a lot of times when I adjust them, they'll sleep longer. And so the parent knows that that's normal or that's okay as we relax that nervous system by adjusting them and allow that communication to flow like it's supposed to in the nervous system, that child might sleep a lot longer that night or might take a longer nap than they normally do. And you probably, a number of you experience that when you get adjusted, you feel more relaxed right afterwards and you can cope with stress. So that's another technique that's really important. One of the things is that, like I said, and I think I mentioned before, that I've been in practice for 18 years, and stress is probably the number one cause of subluxations. It also is something to keep in the back of your mind that if you're experiencing stress, that's when you really want to come in to be adjusted. So say you're a wellness patient that's coming in once a month, but something happens in your life and you have more stress, that is it's beneficial during that time period to come in earlier than you normally would to be adjusted. People that are under stress may not hold their adjustments as long, but if we can keep making those adjustments, we can help the body to cope with the stress. Before I kind of turn over the stage, does anybody have any questions? Okay, thank you. Okay. Well, I'd like to introduce